Good evening, everyone. Welcome to the 7th lecture of the CDM Canada-China Distinguished Lecture Series on Mathematics and COVID-19. 国内的老师和同学们，大家早晨好，欢迎参加这个 CDM 中加数学和新冠病毒系列讲座的第7讲。今天我们非常荣幸 ，Today we are very honored and pleased to have Mr. Peng Fei Gao, Counselor of Science and Technology, the Consulate General of People's Republic of China in Toronto. Mr. Gao is also accompanied by Ms. Jinju Qian, who is the Council of Science and Technology. Thanks for Mr. Gao's support. Now, please join me to welcome Mr. Gao to give an opening speech.
Okay. Hello, I'm the Gao Pengfei, consulate from the Consulate General of People's Republic of China in Toronto. 尊敬的杰恩Hafner 博士、周小农所长、朱和平教授、各位专家、各位同学、网上的各位朋友，大家好。Distinguished Dr. Jan Hofner, Dr. 周小农 Professor 朱怀平 Distinguished experts, dear students, and all the friends online. Good evening and good morning. 很高兴参加本讲座，并在线上与大家见面。首先，我代表中国驻多伦多总领馆，对约克大学疾病建模中心和中国生物数学会联合举办的数学与新冠病毒系列讲座的成功举办表示热烈的祝贺。It is my great pleasure to attend this lecture and to meet all of you online. First of all, on behalf of the Consulate General of the People's Republic of China in Toronto, I would like to congratulate on the successful holding of Mathematics and COVID-19 Distinguished Lecture Series, jointly organized by Canada Center for Disease Modeling at New York University and the Chinese Society of Mathematical Biology. 疫情改变了我们的工作和生活方式，让我们有了新的思考和感受。The COVID-19 pandemic has changed our working and living styles, allowing us to thinking and feeling differently. 首先，面对疫情的全球爆发，越来越多的人意识到世界正在成为一个拥有共同未来的社区，我们必须相互支持，共同努力，加强合作。Firstly, facing the global outbreak of the COVID-19 pandemic, more and more people have realized that the world is becoming a community with a shared future. We must support each other and fighting with joint hands. 其次，全球科技合作是战胜疫情的必然选择。病毒没有国界，疫情不分种族，是我们共同的敌人。各国只有共享科研数据和信息，携手科技合作，才能加快药物、疫苗、检测等方面的进步，从而早日战胜病毒。Secondly, global cooperation in science and technology is an inevitable choice to overcome the pandemic. Viruses have no borders, and the pandemic does not have racial preference. It is our common enemy. Only by sharing research data and information and conducting collaboration can we accelerate the progress in medicine, vaccines, and testing so as to overcome the virus as soon as possible. 第三，数学模型已经成为抗疫的急先锋。3月以来，在加拿大联邦和省级应对疫情的发布会上，我们可以看出他们一直在与模型预测团队密切合作，以模型预测为依据，制定调整相关的防疫政策和策略，从而有效地抑制了疫情的发展。Thirdly, mathematical models have proved to be the pioneer in the fighting against the pandemic. Since March, at the COVID-19 press conference held by the Canadian federal and the provincial government, it can be seen that they have been working closely with the model prediction teams to formulate and adjustment relevant policies and strategies based on the model prediction, effectively suppressing and the development of the pandemic. 第四，数字经济奔腾而来，线上各位将大有作为。正如大家所知，工业革命时代最重要的资源可能是石油、矿产等实物资源。数字经济时代，数据驱动是其发展的本质。数据成为新石油，算力成为新基建，模型和算法再成为新内燃机。数据要素资源成为数字经济最核心的战略资源。2020年4月9日，中国政府发布了关于构建更加完善的要素市场化配置体制的机制的意见，明确把数据列入新型生产要素，与土地、劳动力、资本、技术等传统要素并列。在线的各位都是数据的主人，数字经济将因你们而改变，因此你们将为全球经济发展注入新动能，带来新活力。Fourthly, as we are embracing the digital economy, there is a great future for everyone here online. In the era of the Industrial Revolution, the most important resource may be the physical energy, such as oil and minerals. In the era of the digital economy, data is essential to drive its development. Data becomes the new oil, and computing power becomes the new infrastructure, while modeling and algorithm have become the new internal combustion energy. In one word, data resources have become the most essential strategic resource in digital economy. All of you are the master of the data, and will surely make change to the digital economy and bring new momentum and vitality to the development of the global economy. 最后，预祝约克大学疾病建模中心和中国生物数学联合会开展的系列讲座越办越好。感谢约克大学朱怀平教授的邀请，祝各位专家和同学们健康平安，学有所成，多做贡献。Finally, I wish the lecture series will continue to be held successfully. Thank you, Professor Zhu Huiping from York University, for your invitation. I wish all experts and students safe and healthy, keep learning and make more contributions. Thank you very much.
Thank you very much for those wishes. I'm very happy to be saying good evening and good morning to everybody. Welcome to the 7th Mathematics and COVID-19 Distinguished Lecture. Before we get started, I'd just like to remind everybody about the Q&A button that's at the bottom of your screen. You can feel free to type in questions there, and I will be receiving them to ask questions at the end of the talk. Now for tonight, or this morning. Dr. Xiaonang Zhou is director of the National Institute of Parasitic Diseases at the Chinese Center for Disease Control and Prevention and Chinese Center for Tropical Diseases Research, a WHO collaborating center for tropical diseases based in Shanghai. He has been the vice chair of the Chinese Ministry of Health Expert Committee on Disease Control. He's a member of the Expert Consultancy Committee for the Healthy China Action and Promotion Committee. He's chair of the Society of Medical Parasitology and vice chair of the Society of Global Health of the Chinese Preventative Medicine Association. He's a leading expert in the research and control of parasitic diseases, especially in schistosomiasis and malaria. Tonight, we're very happy to have Dr. Xiaonang Zhou here to talk about modeling-based analytics combating COVID-19. Thank you.
Yes, good evening, ladies and gentlemen, and Honorable Mr. Gao Pengfen. Nice speech, opening remarks in the beginning of our session. Today, I'm really happy to be invited to participate in this series meeting in the on the modeling and against the COVID-19. So my team working on the mathematical modeling since 2013 when H7 and H7 it was happened. So our team working together in a different city, actually from Nanjing and Hong Kong and Shanghai. So when in this COVID-19 epidemic in China, we gathering again and to do some modeling work and up to now. So today I would like to present toward the epidemiology intelligence modeling based analytic combating COVID-19. As you know, the UN Sustainable Development Goal sets up the 17 goals. In the 3D, they mentioned we need strengthening all the capacity in all the countries, in particular developing country, for early warning, risk reduction, and management of the national and global health risks. So our team setup is to respond this document, and all of you know that the emerging and re-emerging infectious diseases are happening year by year, and particularly in recent years, more and more emerging infectious diseases come out. So we have to respond as quickly as possible. For example, when we learn the COVID-19 is moving faster than our expected. So we have to use some modeling work to predict what happened in the future. So this is our team working together. Since I'm an epidemiologist, so I always asking the question, what going to be happen? So this is a figure. We can see what happened in the global level up to the yesterday. More than 7 million people has been confirmed infected with COVID-19, and more than 400,000 deaths already been reported to WHO. So that's why we need a response quickly. So when our team gathering together in the later of February, I raised two questions to them because some of them are modeler, some of them are epidemiologists. So my question is raised as the following two questions: how the COVID-19 disease transmits among different age groups in major social occasions, because at that time the number of the cases haven't to be the top level, so we need to predict what happened at that time, but should be used more detailed data, particularly the age group data. And then when we almost finished this work, then my following question was how to assess the impact of the pandemic COVID-19 on the risk of malaria control and prevention in the malaria endemic countries, which is mainly located in Africa. So this second question was raised actually in the later of April. So let's go to the first scenario. COVID-19 happened in China. At that time, when our team get together and try to do some modeling, at that time, actually, a lot of modeling team working on it. So we discussed what different way we were working from other teams, because we need to predict if our intervention was succeeded, then what will be happen. So the following 3 questions we addressed at that time: how future risks and trends may evolve, and what are the right distancing strategies, and when we will be safe to be reopened. Because at that time, all of us stay at home. So we really expect we need to reopen as soon as possible. So we did that one. Then my team gets the data from a website in the public domain. Then we say, let's see which area they have the very detailed data, and particularly the age group data. But not only the age group, we also need to understanding where they got the infection, where the transmission occurred mainly. So we divided it into the 4 different communities, households, and school and workplaces as our working place, and divided into 7 groups in terms of age group. So these are very interesting in this screen. You can see and group A, which is located in the household, and group D, which is located in the public and communities. There are more diversities to get the infection, which means they really these 2 places are easily to be get infection because of people movement, but quite different from other tools, or such as schools and working place. So in the right column, you can see we mainly to collect those data on the demographic data, as well as the infected cases data, and then we try to predict the or establish the contact metrics for household, school, workplace, and public communities. And then we predicted by using the next generation metrics for the compartment epidemic models. So these are modeling work, and my colleague also stay in this room. Later, they will answer more detail on these mathematical formulas. Then we did 2 works. One is a retrospective analysis, and the second one is we did a prospective analysis. As I said, our team working in the later of February. So until we collected all the data until the end of the February, then we did 3 things. The first, we consider various social distance strategies, such as quarantine of patients and closure of the workplaces and the schools, suspension of public transportation, and the requirements for the people to wear the masks. And those intervention, what's the effectiveness? So we need understanding the epidemic trends without intervention, which show in the Wuhan city in the gray curve, in this curve. And what's the happened after the intervention? This curve occurred in blue curve, and the real data in the background in red color, the pink color, you will see our curve in blue is not only catch up the real cases, number of the cases, but also the potential cases occurred in this area. So when this curve happened, all the cases almost catch in 100%. So consider these are considered with the actual situation. To catch up the peak period was from 4th February to the 14th February. So these are really a good model we set up, and this is a retrospective analysis really can give our understanding what the potential risks happen. Then in the end of February, we also need understanding what the risk associated with the reopening by using the prospective analysis. So which means now we use the another term called second wave. So what means second wave? We using the Beijing data, and we can see same model, but using the Beijing data, we see the curve of in blue, which catch up almost all the reported cases as well as the potential risk cases. So this is really we consisted with our estimated risk trends. So we had this is a prediction curve in 3 colors, and these 3 colors, which means we use the different date for the opening. If we opening in the early date, then we can see the high curve occurred here. Then if we 1 week later and 2 weeks later, the curve recover the curve will be the slightly lower level. So this give us the strategy how we decided the reopening date in this case it was in Beijing. So you can see the second wave we really can catch up very well. So then we using this methodology to also catch up other 3 areas. One is in the Jingji region. This is the economical region around the Beijing and Tianjin. So we using these 2 cities, and also another 2 cities in Suzhou and Hangzhou. This is Yangtze River Delta region, particularly Hangzhou and Suzhou. And we also use Shenzhen as one of city for the Great Bay Area. So you can see the different number of the COVID-19 cases occurred in the size of the ball, and of course the GDP growth rate also slightly different, but almost all of them in the top level in China. So we predict all these cities and really can help us understanding when and what's the impact of the reopening plan. So this really give our great strategy design for the reopening strategy. So by using this table, you can see we actually mimic 4 of 6 different strategy for reopening. Then you can see the B3. B3 is most strict and safety plan. So this can resume the work as later as possible and complete the resumption as slow as need. So which means, but you can see this is the impact to the expected GDP growth. Although this is the most safe plan, but the GDP is slightly lower than the others. So we actually more suggest plan B1. Plan B1. This is a little bit of balance between the data of opening and the impact to the GDP growth. And those GDP data we actually collected also from a website, public domain. So from this study, actually, this gives our 3 hints. The first one, with an in-depth characterization of age-specific social contact-based transmission, the retrospective study and prospective study on this disease outbreak can be analyzed very well using the computerization modeling. and also can be give the reasonable explain. Particularly for my epidemiologists, we really can explain very well. Second hint is AI enabled methodology, as well as a study conducted in the representative cities in 3 economic zones in China. Is general and instructive in strategy planning in other countries and regions. Actually, we got some response after our publication, particularly from Spain. We provide some tools to them, and the Spain also using our tool to analyze their own situation. So the data science tools already being put into available in the public on the website. You can see in the website of the Hong Kong Baptist University. So this publication was actually online in the middle of April. So right after this finish this work, then because we have some cooperation already on the malaria in Africa, so then I raised the question how to assess the impact of our pandemic COVID-19 on the risk of malaria. Then on the 25th of April, this is World Malaria Day. Actually, WHO published one of prediction at global level. The major conclusion from the WHO team that once the COVID-19 happened in Africa, then stops all the intervention in the Africa. The total number of malaria cases maybe will be double compared with 2018. So then at country level, they didn't put give us any data. So then I asked 2 questions to my colleagues. The first one is data-driven analytical methods to assess the potential deterioration of the malaria transmission risk. Is it possible? So then second question is the disruption of the distribution of the insecticides treated nets in malaria endemic country in Africa during the COVID-19 pandemic. What will be happen if all those intervention, particularly the ITN, is stopped? So because we raise the ITM, the insecticide treated net, because this is in the list of the top of intervention, together with the indoor situation spraying and the seasonal malaria chemical prevention and access to a diagnosis and effective malaria treatment. So all those are actually around the World Malaria Day, a lot of discussion on that. So our team reuniting and analysis this situation by using the classical SEIR model, because this model has been used in the prediction of the COVID-19 outbreak in Spain and Italy. And so we using this, we apply this one, and also in combined with the epidemiological parameter I0 and the as well as the period infection to fitting the cumulative number of the reported cases in COVID-19. So these are 2 figures. You can see what was R0 we select, what is DI we selected. Then we also did some prediction. Then we need to try to put together between the COVID-19 impact as well as the results of the malaria situation. So we assume the effect of social distance intervention by discounting the indicator rate beta to 50%, 25% and 10% among different time. For example, on May 3, May 3rd, and May 30th, and 1st of July. Because at that time we are staying in the April, middle of late of April, so we predict May and July. So we can go to the in case of Nigeria, we use the country level data and to see what happened in the different 3 days in May, earlier and late May, and early July. So this right, you can see the different intervention in a different day, and they will give us a different impact in terms of number of COVID-19 cases. So after we understanding the curve of the number of the COVID-19, then we try to link it with the risk of malaria transmission, and so we using the following 3 factors. First one is by acting as a physical barrier between the mosquito and the people sleeping under the net. And the second one is the chemical in the ITNs repels mosquitoes or kills them when they land on the net. Through the third one is through the community effect, which occurs when the majority of people in the community sleep under the ITN, so resulting in an overall reduction of the mosquito population and its lifespan, thereby reducing the transmission of malaria. So when we understanding these 3 impact factor between how to link it with the ITN and the risk of malaria transmission, actually we use this different way to see. So these 2 lines, up line was COVID-19 occurred the top during in the middle of May, and the impact is the highest in the May as well. And then once we understanding these 2 curves, then we establish the model as in the right side, left side. So this model actually we can see the distribution of the ITNs will be changed with the COVID-19 cases through times in 3 different days of the intervention for the COVID-19. The bottom one was 2nd May, and the middle one in green color is the intervention occurred in the later of May, and the top one was because the intervention was later, so then it may be impacted higher in blue lines. So this impact to the malaria in the right side is also in different ways. So then we try to understand how to make them earlier warning, actually by using our previous experiences. We working either in the Africa and the China, southern of China. So that was we during last 10 years, we actually will majorly focus on the vectory capacity, which means the mosquito transmission capacity for the malaria, and which are impacted by temperature as well as rainfall. So this is a conceptual model framework. And you can see this is we can use the called VCAP, VCAP. So VCAP map of China, of Africa already been published, and the up level of the right figure, this is reception level together converts with VCAP in the Madagascar as well as in the China. So we're using our old experiences, and then we see in the what happened in the Nigeria, and we get the 16 years VCAP within the 12 months. So you can see this is the average curve among this 16 years VCAP. So this seasonal change is very clearly showing that. So then this VCAP, what happened with COVID-19 pandemic? So this is we using this. We got the 3 different results. So you can see once the intervention of the against the COVID-19 pandemic in red color, this is the early intervention. This will be less risk of malaria. And if we take the intervention later, then the malaria impact will be high. So you can see more than double of the malaria cases will be occurred in the later of October and early October. So this give our alarming that once the COVID-19 occurred in the Africa, this impact to the malaria is really huge. So we need to take a more early response to the not only the COVID-19, also the malaria outbreak. So these are our 2 results majorly I reported here, and this is the figures of our teams. So particularly I would like to thank Professor Jimin Liu. He is a chair professor from Hong Kong Baptist University. So we met each other in the Geneva WHO meeting, and we in early 2010. So then we work together up to now. And we also thanks Professor Yong Si, State Counselor from Chinese Academy of Science. He provided a lot of constructive suggestion and recommendation, particularly how to link between COVID-19 and GDP growth rate. And so all the young guys on the second line, they are produce a really good model and data as well. So actually, together with Professor Jimin Liu, we already set up the Joint Research Laboratory of Intelligent Disease Surveillance and Control. Started from 2013. We established in Shanghai, and every year we had some meetings and exchange our experiences. So when no any emerging infectious disease occur, then we're working on the malaria. Once some emerging infectious disease come out, we will work together on it. For example, in the 2012, we're working on the H7N9. We predict a very nice map, risk map actually, in the very early days of the disease outbreak. And also we're working in the China-Myanmar border for the malaria, and we have published several papers almost every year. So in this year, early of this year, we work together again. So we really happy we can got very good results and provided a very good recommendation to the government on how to strategically design of the reopening strategy. Thank you once again for your attention. So our team, my 3 colleagues also waiting in this room to ready for the answer questions. Thank you. Over.
Thank you very much for this illuminating talk. We are now open for questions. So if anyone has a question, they can direct it to me using the Q&A button at the bottom of the screen. And the panelists can feel free to use the chat button. Is anyone ready for a first question?
Jan?
Yeah.
Yeah, first, thanks, Xiaonong, for the interesting talk, especially you connect the COVID-19 with mosquito control, malaria in South Africa. So as you can see, these two, the pandemic situation of COVID-19 in Africa and the mosquito-borne diseases. So I see you mentioned ITN. So the connections between the two, because you see earlier for the COVID-19, people you see were thinking this is due to some animals and human virus, just like you see the animals will serve as some kind of vectors. So in terms of animals and humans, you see mosquitoes. So what is your opinion about you see controlling mosquito-borne diseases and this COVID-19? You see, that is for South Africa. For example, for North America, do you see we have a similar type of problems?
Yeah, thank you so much for this kind of question. Actually, now up to now, we understanding the impact of COVID-19 will be sustained for a long time. But not only this year, maybe even next year or even next year. And so people more thinking about the syndemic between the COVID-19 and other infectious disease, because all the people had the quarantine and stayed at home, and no people working on the disease control program, particularly like malaria, they transmitted by mosquito in the rural area. So this kind of impact for the developing country, the lack of the resources, they are really important. People needed to consider. And also for the foundation, all the foundation put the money to the COVID-19. They are really less funding goes to the malaria program. So this intervention for the malaria will be less and less. So this is syndemic way we need understanding as quick as possible. Now, at least from WHO as well as our team, we consider we cannot take all the money or funding from the malaria control program in Africa, at least in Africa. But in the North Europe and Northern America, probably slightly differently, because the mosquito-borne disease, or we call the vector-borne disease, is really happened in the tropical area, and in the Northern America and the Northern Europe, maybe they are less impacted. But maybe other infectious disease, other kind of syndemic way you need to consider. For example, the Western Nile virus. This another kind of mosquito borne. So disease. So particularly in the rural area, so people need to take care of it. So this is my suggestion. As I understand, several years ago, almost 10 years ago, the Western Nile virus spread very quickly in the Northern America. So this need to take care. Thank you. Over.
Thank you. Thank you.
Thank you. I'll now turn the table to Michael Lee.
Hi, Professor Zhou. Thank you very much for the beautiful talk and very impressive work. And yeah, I recognize that the contact patterns among age groups are really important for COVID-19. We had some experience looking at the age structure models for influenza, seasonal influenza predictions. The COVID-19 seems to be more of a challenge. My question is related to how should we kind of deal with the changes in the patterns of contact during different phases of the COVID-19. For example, before the lockdown, where school is still open, but during the lockdown, then everybody stay home. And then after the reopening, some kids go back to school, not everybody. So how should we kind of deal with that? That seems to be really a challenge for me. I'm just curious how should we do. Some comments would be appreciated.
Yeah. Thank you so much for your question about the social pattern, particularly school. And up to now in China, some school, particularly like a university, they still not reopen yet. All the class still be run on the web AN. So internet can help a lot on this for the internet course or MOOC. Because when the students get together, once they have one infectious resources, that will be transmitted very quickly, and so these are very difficult. But for our data, when we got from the public domain, and as you know, in the beginning of February, China already had the Chinese New Year festival. So all the school actually at that time already been closed. So that's why the school actually impact was not so serious compared with the community and household. So during the epidemic, particularly in the Wuhan, the majorly transmitted or cluster cases happened in the household. And the second one was in the community. So this we understand it because of the social activities help the transmission of the COVID-19. These four different community level is really help us to understanding what's the various differently in the different age group. So thank you for your question.
I think I'll add to that question. So we have a question from one of the visitors or participants, Dajo Go, and they're wondering, when you look at the contact matrices that you have developed, have you thought about extending this to look at pediatric or childhood diseases like pertussis or measles or anything like that with school closure?
Thank you for this question. Actually, at that time, we are mainly focused on the COVID-19. We not yet consider the other pediatric disease yet. So although we including the different ages for young ages and 7 different age group, but for the other co-endemic disease, not yet in the city. But for my understanding from the epidemiological data, showing that during the COVID-19, because everybody wears the masks and they keeping the social distance, so the other infectious disease become the lower and lower, almost in the lowest level in the history. So this, which means all those intervention are non-pharmaceutical intervention really help to control other infectious diseases as well. So this is my understanding. Thank you.
Sure, and then adding on to that, we have another question from the audience on just asking how you determined the contact matrices. Were they from the literature or were they from your own data?
Okay, this question maybe I need my colleague 本云还在吗？还是那个刘洋在吗？
Okay, I'm here.
Yes,
Professor Zhou.
you can respond. Yeah.
Actually, there are some studies talking about the content matrix, and there are also some publications using the content matrix to build a complicated transmission model for different disease. Actually, the method is from literature, but the data, the data is from different. We have studied 6 cities, so we collect the age group structure from different cities, because in China, different cities, the age structure is very different. So and also we have built four communities. The age group in different cities, the weight or the content weight in different scenarios. For example, the household, the public community is very different. So we learn the weight from the data. So this is how we build the content matrix and fit to the real curves of the epidemiology. Yeah.
Thank you, Ben.
Thank you.
So, it's remind me when we discussed. Fortunately, one of member of our team, Dr. Xia Sang, he did some metric analysis several years ago on the vaccination impact of vaccination. He used a similar way, so he transferred this way to the COVID-19 to understanding the intervention, non-pharmaceutical intervention. What's the impact of these interventions? So we had experiences and also publishing, but they use the real data at that time from different cities. Thank you.
Maybe I can ask a technical question to Dr. Shi. Now you have a contact matrix among the age groups, and as your time goes on, do you change that contact matrix? Is that changes with the epidemics?
For the COVID-19, we didn't change the group. Yeah, but we in our group we have another students have already published some paper. We studied the H1N1 in Hong Kong. So the contact structure is changing. We have observed from using the learning method for the within the H1N1 pandemic transmission. We have several phases. We have learned different type of contact matrix, the shift from one type to another. So the paper is already published. Maybe you can, if you can search from it's available from the Professor Jimmy Liu's website. Yeah.
Right. Yeah, that I understand. I know how to compute these contact matrices from. I'm just thinking, we were thinking about using some flu data to do the COVID-19, but then our kind of concern is there isn't much social distancing during seasonal flu, or even during the pandemic year. People just a little bit more careful, but not as much of social distancing as this time. Everybody stay at home. People don't go to work. So that kind of a contact, where do we get contact data? That's the challenge we had. You have that's sort of why I'm curious about this, right? And most of the social contact data rarely incorporate this level of social distancing. For example, if you think about Wuhan, the way they shut down the city, has never been seen in the world. So where do we get that kind of contact data? Right? So that's sort of always a hard problem there. Yeah, I understand. So appreciate that. Thanks very much. Yeah.
Actually, there are some very different skills of human activities within a city or within a community, and also cross city. Many work have using the mobility human mobility data to simulate the epidemic. So when we do this COVID-19, we also use mobility data, but we Professor Zhou didn't mention in the slides. For within one city, actually, the age group, especially at the early stage of the transmission, is I think it's very important. Yeah, thank you.
We have another question. This time it's about malaria. So in your slides, you showed two, like a larger malaria season, and then there was a smaller one. And so Joshua is wondering what's really driving that. Is it the rainy versus dry season? And what's actually, for my question, what's that smaller rise at the end of the slide? What's causing that?
Thank you so much. Because this data is from the Nigeria, and in Nigeria they normally have two peak. One is a big one. This in the right after the rainy season, and then in the beginning of the dry season they have a second curve. And actually, this is really related to the raining raining patterns. So the moisture and raining fall is really related to the malaria transmission. So this of course temperature also involved. So that's why this V cap is very, very high right after the rainy season. So we understanding this is a right pattern, and the normal way is really like this. Thank you.
And so in terms of coupling that with COVID-19, so you talked about malaria controls and funding for malaria control. Can you speak to whether they are still planning on doing some spraying in against the mosquitoes?
Mm-hmm. Yeah, well, one of the recommendation from our team to some foundation, international foundation, was that the mosquito should be treated by the spraying in some way, and we even suggest using the drone to spread the larvicides in the outside of the room. Of course, inside the room, the local people can do that if you provide some insecticides to them by themselves. So this should be response as soon as possible. Otherwise, this kind of prediction, the double level of the number of the cases will occur in terms of epidemic situation in malaria in Africa. So this we need a concern a lot. Thank you.
Okay, so I'll open the table for a couple more questions if anybody has any.
Professor Zhou, very good talk, very interesting. My question is, international flights may be important for Beijing. What are influences for imported case to Beijing?
Imported cases of the COVID-19 or malaria?
COVID-19.
Okay. As you maybe also understanding, the local cases has been reduced significantly after the May. So up to now, they are very low risk for the transmission locally in China, unless only 2 recently cases happened in Beijing. And from media, they mentioned those probably relate to some seafood as well. But I don't know if, but this is only from media. But anyway, the local transmission really control very, very well. But now we had a very, very high risk on the import cases through the international flights. So all those people come back from outside through the international flight will be the check, not only the check for the temperature, also give the test for the fast test for the COVID-19 by using the PCR. So all these people, if the positive will be treated immediately, or they put into the some quarantine 14 days for the quarantine time. So this I think this kind of control strategy or preventive strategy is really help for the control of local transmission in China, because China is so huge. I'm located in Shanghai. We haven't have local cases, local transmitted cases since the beginning of March. So now everybody already come back to the office and working as normal. So this is a real situation in China. So thanks for those people working in the disease control and prevention, and they're working very, very hard, really very hard, even now. Thank you.
Thank you.
Dr. Zhou, in fact, like just follow your explanation. You know, like you see earlier reported, the virus started in the seafood market. Now in Beijing, it's just like 1 or 2 cases. Anyway, according to media. Do you think it's important, or how important, if we try to study, for example, environmental impact? You see some area environment is polluted with the virus, so that may eventually cause problem too.
Yeah, thank you for your raise this question. Actually, these days after the outbreak of COVID-19, my personal interest is move to the One Health. One Health means connected with human, animals, and environment. So your question is address the environment. Yes, my short answer is yes. So I, together with the Shanghai Jiaotong University, we set up the One Health Center, just open, and we identify those working area. So in the future, we really need to take a more intensive work on the surveillance for the animal and the environment. This really can help for our preparedness to respond to those emerging or re-emerging infectious diseases. This is important work. Thank you for your raising this question. Thank you. So my first title in this slide was the head of the One Health Center in the Jiaotong University, Shanghai Jiaotong University Medical School. Thank you.
Yeah, thank you.
Yes, One Health is certainly becoming, or is already, a very, very important thing around the world for every country, for every disease, all these diseases that are spreading around the world. So certainly something really important for everyone to take home from this talk today. Before we wrap up, I'd just like to ask Dr. Huaiqing Zhu if he has an announcement to make before we close the session.
Thank you, Dr. Zhou, for the interesting and important talks, especially mentioning One Health. Thank you all. So enjoy a wonderful evening and a nice weekend. Thank you, Jian, for the moderating. Thank you all for participation. So next, starting from this week, you see this, maybe we are missing some participants because we switched from Saturday to Friday night. So this is like, you see, starting of next week. So we will continue to run the seminar on Friday in the evening in North America, but Saturday in the morning in China. So welcome to participate. Thank you all. Bye-bye. Good night.
Thank you.
Thank you, and thank you, Dr. Zhou. Good
Thank
night.
you. Bye bye. Bye bye.